Welcome to your inpatient status board overview. This video will walk you through the standard build of a status board for the inpatient units. To begin, when you initially sign into Sunrise Clinical Manager, you would be used to seeing a view that has your patient list. We will be asking you to switch over to a view called Status Board, and that can be done two ways. You will have a button called Status Board here, or if you go to the bottom left-hand corner, there is a button called Sidebar, and you're able to then select Emergency Care. That will as well take you to your status board. Your status board will be defaulted to the department for which you are working. Under Views, you will always be defaulted to the All Beds view, but there is other views that you can access as well. The status board is a communication tool that shows the up-to-date status of your patient. The columns are auto-populated by registration services, lab, or medical imaging, but there is also columns for which data entry is required by the various roles in your department. To begin, the location column is auto-populated by registration services when your patient is registered. So this will show you the location of your patient. Status column, STS, will either show you the status of the bed, and we have different statuses. This column, when you highlight a row and you double click, it opens up a drop-down list. The drop-down list gives you different options: dirty, out of service, reserved, terminal clean, or occupied. Each one of those statuses are color-coded. The status for your patient always defaults to admitted for when they are registered. You do have options, however, to change it to pending discharge, pending transfer, or when they are discharged. When you select pending discharge, it flashes green. When you are discharging a patient, you would double click, select discharged. It will then open up another window asking you if you want to remove that person from the status board. You would select yes. That bed automatically turns dirty. If you have removed that patient in error, you can go to a view called Inactive Patients. Your patient will still be there. You can select, right-click, and return that patient. And you can return that patient to the bed that they left. I'm just going to update this to admitted. Please be aware, you still are required to use Allscripts patient flow to arrive your patient, to submit transfer bed swaps, and to also discharge or depart that patient. So you do need to remove your person from the status board when you have transfers and when you have discharges. The patient column will auto-populate from registration services, and you can see that you have patients here that are color-coded according to gender. Pink for girl, blue for boy. You will also notice, though, in the patient column, you have different icons. The two-person icon is indicative that you have a patient on your unit that has a similar last name, and you want to let your coworkers know that you have two patients of that manner. To put that icon on, we go to the far right-hand side, and we have a name alert column. You select, and it then adds that icon. The bacteria icon is added when you have selected an item in the isolation alert column. The yellow triangle is automated from registration, and that is indicative of a patient who is 70 years of age or older. And finally, the sunglass icon. Sunglass icon is indicating that this person is confidential. The only way that you're able to see that patient's chart is when you select that line. You're then able to see that patient's name in the patient header. The age column is auto-populated from registration services. Diagnosis. The diagnosis column, when you select and double-click, this is free text. Upon admission, you can enter in the diagnosis of the patient, but then you can absolutely change that when you have bed rounds or the diagnosis changes and you want to have an up-to-date information on that column. COVID screening is as well a drop-down list. Your options here reflect your screening tool for COVID and your assessment. Criteria unmet is black. When you have met and not swabbed, it will be flashing yellow, indicating that you still require a swab to be collected. Met and swabbed, negative and positive. Isolation alert is as well a drop-down list of all the different options, and they are color-coded according to the health authority codes. Bed call for assigned. This column will populate when a transfer request has been put in and we have a bed that's been assigned for your patient. The coloring matches the status of that bed. When it is flashing green, it is indicating that that bed is ready. If it is brown, it indicates the bed is dirty. Gray, that bed is occupied, and yellow, the bed is being cleaned. The next two columns deal with discharge dates. In Allscripts patient flow, you are entering in a pending discharge date. From patient flow, that date is being auto-populated in the targeted date of discharge column. The days to discharge column then is activated to indicate a countdown of that days to discharge. When you are 3 days away from discharge, it will be red. 2 days is yellow, 1 day is green, the day of is a flashing green, and if you've missed your target, it'll be a +1. Anytime that you see the little dot in the column, that indicates a pending discharge has been entered, but we have not reached the 3 days away from discharge. Alternate level of care column, that is auto-populated from the document that is created on Sunrise Clinical Manager called Alternate Level of Care, and that is completed by your clinical coordinators. When that document is created, it will put the date of the creation, indicating that when you select that patient, you can also go to the Documents tab to look up that document. When it indicates reverted, it means that that person has decompensated and the patient is now back to an acute care status. Barriers column is free text. What are the barriers that are stopping that person from being discharged back to the community? Nurse column is as well free text. The MD column is auto-populated from registration services. Consult service is a free text. If you have 1 consult or 2 consults of a medical specialty, you can indicate that in here. When that patient has been seen by that consultation services, you can highlight and remove. New result. This is a flag that gives you an indication that there is information that you need to look at. So that can be from lab, medical imaging, echoes, ECGs. You can just double click and it will then bring open your result. At the bottom, you have an option of clearing the flag or don't clearing the flag. Temporary location is as well a drop-down list. Temporary location is indicating that your patient has left the unit for a long period of time. So that could be going to dialysis, it could be going to the operating room. We use it for long periods of time when that patient will be off the unit. And then lastly, name alert. I do want to indicate if you are on a unit at the Royal University Hospital, you will have 2 additional columns added to your board. And those columns are the order statuses. These columns are added so that you can see what the order entry is that you've completed. So it gives you a running tally of labs that have been ordered and medical imaging that's been ordered. When you see the ratio, that is indicative of the fact that you have 0 results and 3 lab orders ordered. I do want to note, each clinical unit will have a work standard outlining who will be responsible for the data entry on each one of these columns. Please check with leadership as to the work standards so you can become familiar as to what your role will be. Thanks.